Hello folks, this is Dr. Alfred Hauk, Dr. Singh, and I'm just sitting here in our IV suite enjoying a little bit of some nutrition going directly into my veins. And so while I'm relaxing here, Dr. Singh is going to explain a little bit about IV therapy. We have two naturopathic doctors here at Holistic Healing Arts who do IV therapy. That's Dr. Singh and Dr. Albano. And so please, and we get a lot of people in here enjoying the benefits of it. Explain a little bit about what it's good for and what it does.
Absolutely. So,
Hey, maybe with your mask.
oh yes, I forgot about it. I'm so used to wearing this mask.
Because we have to wear all sorts of protection when we have our clients in here getting IVs. We're very, very cognizant of how important it is for patients to come into our clinic and feel safe, knowing that they can get good treatment here without having to worry about COVID. So we're doing all the right things in that respect. But yes, go on.
Yes, and thank you for reminding me about that.
It's hard to hear, I think, sometimes.
Yes, yes. Yeah. So hopefully everyone can hear my loud voice now. So I think just very quickly, obviously anyone getting IV therapy in our clinic, they have to be a patient of the clinic. There are certain pieces of blood work that need to be done in order to determine whether they'll be a good candidate for the IV. Before any IV, as we've done with yourself, we check your vitals, your pulse rate, oxygenation, blood pressure, temperature, of course, and then we would proceed with an IV. So what you're having today is a modified Myers infusion. So it's done in a saline solution, and we have your sort of general, vitamin C, vitamin B5, vitamin B6, B12, calcium, magnesium, and a little bit of B complex. And the Myers cocktail, as we call it, or the Myers infusion, it can be, the ranges of benefit from just general overall well-being. We can modify certain nutrients in there. Let's say someone's coming in with chronic migraines. So then I might adjust the magnesium and B6 content. Athletes or people who are getting ready for an event or a marathon, or who just need that extra support for getting through their exercises or training. Malabsorption issues. Right. These are individuals who don't absorb as effectively, no matter how high quality the supplement might be. This is an excellent way because you're getting 100% of the vitamins going directly into your circulation.
So some folks who are struggling with even good nutrition or even supplements because of some trauma that they've had or some type of therapy, chemotherapy or otherwise, and now there's some issues with their absorption, this is a wonderful way to kind of prime the pump and get this good nutrition in their veins. As that starts to heal, then their digestive system follows in, and now they can start absorbing better.
Yes, and that's a very, very good way to put it. Yeah, so initially, we're bypassing the GI tract, giving a high concentration of these nutrients. And the other thing to remember is that everyone is individual. I'm not going to always be doing the same cocktail for every migraine sufferer who comes in here. So we definitely individualize, each case. It's case to case. And again, I have the flexibility to tweak certain nutrients or vitamins depending upon what our goals are.
Yeah. So it's a great therapy. I get some once in a while myself, just for the heck of it. I used to do IV therapy years ago. I'm quite happy to have retired from that and passed the baton on to Dr. Singh and Albano, and it is something that many people benefit from, and it's worth looking into for a lot of applications. And here we are able to do that for you even during these very stressful and trying times. So pop by, talk to our front staff if you have any questions. And the other thing I wanted to ask, or just say, if I could, is that we're doing these little weekly vlogs, Dr. Singh and I, and maybe some of the other NDs later on. And we're open to suggestions. So when you see this on our Facebook or Instagram or any of our social sites, maybe make a comment, or if it's a negative comment, maybe send it to us on Messenger. Just let us know how we're doing, if there's some things you'd like us to talk about that you would find interesting, and how we could improve our ability to share some of the information we have. So again, thank you for listening in, and we'll talk to you again next week.
Bye, everyone.